Okay, here we go. Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health. Dr. Vinita Dubey is joining me again today. Thank you for being here, Doctor.
Of course, thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City News and City News 680, and I'll be moderating this chat today. And the way it goes is we've been collecting questions for the doctor over the past little while, and we'll be presenting them to her today. She's never seen them before. It's all off the cuff. Today's topic is COVID-19 vaccines for kids aged 5 to 11, or kids in general, because that's the hot topic right now. We just started bookings on Monday, so lots of people have lots of questions, and we're going to be taking those today. If you haven't had a chance to submit your questions, you can still do so in the live chat, and we'll try to get to as many as we can. We only have 30 minutes with the doctor, so we're going to get started right away. Doctor, let's start with the questions that we have submitted, and then we'll take the live ones as they come in. Are you ready to go?
Yeah, let's go.
Wonderful. Okay, let's start with Michael's question. Michael says, should 2010 kids be getting the pediatric dose or the adult dose, considering that they're just 1 month away from being eligible?
Yeah, so you should get the vaccine based on your current age. So if you are 11 on the day of your vaccination, get the pediatric dose. If you turn 12 by the time your second dose is due, get the dose for the 12 years of age and older. You may say, well, it's just a 2 month difference. Why now all of a sudden is the dose difference? Well, we know that that's what was studied. So 12-year-olds were studied at the higher dose, the 30 microgram dose, and 5 to 11-year-olds were studied at the 10 microgram dose. So that's what we are recommending.
Okay. And then Jenny has an interesting question. We've tackled this before. She says, my 11-year-old is big for his age. Do you think the pediatric dose will be sufficient protection?
Yes, I completely hear you. You know, like some children grow taller, bigger than others at different stages, but it's actually not the weight that is determining the dose, it's the age. And the age is actually tied to the immune system and how the immune system grows and how it responds. And we know that that younger age group actually has a strong immune system, a really strong immune system, and they often respond very well to vaccines, which is also what's being shown here in the COVID vaccines. So get the vaccine based on your age, regardless of size, for example.
Right. Okay, that makes sense. And then this one's coming from Twitter. My 7-year-old is allergic to tree nuts. Any issues taking the vaccine?
No, tree nuts are not a contraindication to be vaccinated. In fact, food allergies, medication allergies, environmental allergies, like those are not contraindications to getting vaccinated. There are very few ingredients in the vaccine, polyethylene glycol and tremethamine. Again, rare ingredients used a lot in medical treatments, for example, like in laxatives for children, like Restoralax, for example. So if your child has a severe allergy to any of those components, they should see an allergist. But other than that, allergies, any other allergies are safe to be vaccinated, similar to what we were doing in adults and 12 to 17-year-olds.
Yes. So doctor, when it comes to adults, we said that even if you may be allergic, you can probably still take the vaccine under supervision of an allergist. Is that the same case for children as well, or should children avoid it if they're allergic?
It's likely to be the same case. So, you know, if a child sees a pediatric allergist, then under controlled settings, maybe testing, maybe pre-treatments, they can likely probably get the vaccine. But again, better to have that conversation on an individual level.
For sure. And then let's move on to Anne-Marie's question. Why did they switch out saline for tremethamine in the kids' shots? That's the question.
Okay, so tremethamine is an ingredient that's added in the pediatric vaccine. It's not in the 12 plus a Pfizer vaccine. It is, however, in the Moderna vaccine.
Okay.
And what this ingredient is it's, for example, commonly used in IV dyes, IV contrast dyes. So, for example, if you get a CT scan in the hospital. So it's used as a medical ingredient. It's a type of buffer or stabilizer. My understanding is that the change was to allow the vaccine to be more fridge stable. And we know that that's important because when we had the vaccine for adults, in the new year, it could not be stored in the fridge for very long. It meant that doctors and pharmacists could not actually have the vaccine. It just logistically made it harder. So they made that change in formulation. And so this vaccine can stay in a fridge for 10 weeks, which means that doctors, pediatricians, pharmacists, they can get the vaccine. And that's actually a very good place for parents to get their kid vaccinated.
Right. And so, but doctor, it's only in the pediatric dose. It's not in the adult dose?
It's not in the adult Pfizer vaccine. That's right. They didn't change the adult Pfizer vaccine because they would have had to then get it reapproved by Health Canada.
Okay, so they submitted it with this new ingredient for approval. Okay, got it. Okay.
That's right. And that's why for kids, we're not giving the adult vaccine, but at a lower dose. It is a separate pediatric vaccine because of these few small adjustments.
Oh, okay, good to know. Okay, so it's not just like, you take the same vial and it's a smaller little dose, right? Okay.
Exactly.
Okay, got it. Okay, and then AD, it's a similar question, but let's take it. AD says, if my 11-year-old gets the pediatric dose now, will she get the adult dose for her second shot in 8 weeks because it's the year she turns 12?
Yes, now that is the recommendation. Now, suppose she got the pediatric dose, not realizing it, that's okay. You wouldn't need to get her revaccinated. But the recommendation is as much as possible to get the vaccine dose based on the current age.
Okay, so if you're 11 now, you get the pediatric dose. In 8 weeks, if you turn 12, you get the adult dose.
That's right, yeah.
Okay, good to know. And then Kathy asks from Twitter, why can't the COVID vaccines be given in schools?
So the COVID vaccine will be given in schools, but the clinics will mostly be after schools. The reason for that is because parental consent is required. We're also vaccinating down to age 5, and often a 5-year-old, a 6-year-old, even a 7-year-old, even an 8-year-old, I mean, even up to 11, probably would like to have a parent there to get the vaccine rather than being vaccinated, with the class in a gym, for example.
Yeah, for sure. I mean, I want a parent there still, and I'm well past 11. Let's not get into that. But yeah, absolutely. So, okay, let's, this person only has initials FCHE, says, how many serious or fatal COVID cases have there been in children that this vaccination is expected to prevent?
So actually in Canada, there have been 2 children who have died of COVID. There have been 300 hospitalizations, not a lot, but out of, the total number of children who have gotten COVID, it's 0.04%. So it does certainly occur, and it can occur even among children who are otherwise healthy. So, and then if you compare to the vaccine itself, the risks of the vaccines are very, very rare. In fact, we haven't yet seen any of the rare side effects occur.
Right, absolutely. And as we've been seeing, like yesterday, we had a couple of stories on City News as well, saying that, cases in kids are rising. It's not that they can't get it and can't spread it. So if that's the demographic that's left to be vaccinated, that's probably the next step, right?
Yeah, that's a very good point, that now the chances of a kid getting COVID are even higher. They have the highest age standardized rate in our city, but even across the country as well. And we're seeing that in other parts of the world as well.
Yes, absolutely. In the US as well, it's been spiking for sure. Okay, let's talk about the sort of questions that we've aggregated from other questions that we've seen over the past few weeks. The first one is the kids' vaccine dose and ingredients the same as the adult vaccine?
No, the dose is smaller. So it's 1/3 the dose. So in the adult, we say adults, but it's actually for 12 years of age and older. So just want to be clear on that. But in that vaccine, the dose is 30 micrograms and the pediatric dose is 10 micrograms. The ingredients are mostly the same except for one ingredient, that tremethamine. And that's, again, added to the pediatric vaccine. It's a stabilizer. It's in the Moderna vaccine, so we actually have experience with it in a messenger RNA vaccine and is a safe added ingredient.
Okay. And then the second question is, what kind of side effects can my child expect after taking the vaccine?
Actually, the side effects in children are even less than what you would expect even in older teenagers or in young adults, actually. So the commonest side effect is a sore arm. In the trials, about 70% of children had a red, sore, or swollen arm, and that is to be expected. Mm-hmm. Now, beyond that, 40% were tired. Some had muscle aches. Some had chills. Only 6% had a fever. So again, the symptoms can occur in children. They usually occur 1 to 3 days after the vaccine. But again, they're on the mild side. They don't last, and they tend to occur less common based on the trial data.
Okay, that's great to hear. And then are kids' vaccines going to be available at family doctors' clinics?
Yes, it's up to each family doctor's clinic to order the vaccine to have it available. But yes, that is an option this time around. So you can certainly call your clinic to see if they have the vaccine.
Right, because it might be a little more comfortable for children, I think, when it's especially the younger ones, when it's a mass vaccination clinic, there's so many people, all of that kind of stuff could be overwhelming.
That's right. And often parents have that relationship with their doctor, whether it's a family doctor or a pediatrician, even a nurse practitioner. Mm-hmm. And so it may also be a very good place for parents to get their questions answered for getting their child vaccinated as well.
Right, exactly. And okay, there's a question coming in live on our website. Coral asks, my son is 11 years and 10 months. I want to give him the adult doses. It doesn't make any sense right now to get, the smaller dose because he's going to be basically 12 years old in just 2 months. Should I wait?
So I don't recommend waiting, because by waiting, you run the risk of your child getting COVID, right? And so I would get, if your child turns 12 in 2 months, what will happen is your child will get the first dose pediatric, and then the second dose will be that higher dose vaccine.
Right. And when it comes to kids who are so close to turning 12, can they get the 12 to 18 vaccine 12 and up vaccine right now, or do they would have to turn 12 to take it?
Yeah, so right now, 11-year-olds who are turning 12 by the end of this year, right? Born in 2009. That decision was made in the summer because we didn't have a vaccine for 5 to 11-year-olds. So I think I would definitely recommend getting the vaccine based on the dose. I think it's important to note that the smaller dose, it may seem like, well, I want to give my child the best, the stronger dose. Yes. But actually what the trials showed was that in that age group, they don't need that larger dose. Actually, the vaccine worked. It still had 90+% efficacy, but also by giving a smaller dose, you have less side effects as well. Right. So I think that's another really important reason to get the dose based on age.
Right. And I think honestly, if you don't need more of a medicine, why would you take more of it? It's not always the case that if you take more of it, it's going to be better for you, for sure.
Yeah.
Okay. And then let's move on to some more questions here. Will these vaccines become mandatory for kids? Like school vaccines?
It's really hard to predict into the future. Again, vaccines are not mandatory right now to attend school. The COVID vaccine isn't, but we have this proof of vaccination in other settings. And so we'll just have to wait and see, travel requirements as well too. They, as with all things COVID, you really can't predict into the future. But I think the one thing that's fair to say is, usually before you make a vaccine required, you give time. You give time for parents to get the vaccine,
Right.
Logistically to be able to book an appointment and also to make their decisions as well. Now, there is no question, though, that for a child who's, say, traveling abroad, we know that traveling poses higher risks for getting COVID. And so you would certainly, for some of those things, want your child to be vaccinated as well.
Right, absolutely. Because if they're unvaccinated, you come back, the parents don't have to quarantine, but the kids will have to quarantine for 14 days, correct?
Well, okay, let's talk about that. Yeah. So if you have a 12 to 17-year-old who's traveling, it doesn't matter who they travel with. Their parents could be vaccinated, but if the 12 to 17-year-old is unvaccinated, yes, when they come back, they have to quarantine for 14 days and get testing, cannot go to school. Now, if someone who is 11 or under, and if they travel abroad, even to the U.S., with a parent who is fully vaccinated, the child who's 11 or under does not have to self-isolate. However, they cannot attend school, childcare, early on centers for 14 days. And that is part of the federal requirements. So even though they don't have to self-isolate, they cannot go to school, for example, and they're still going to be required to follow the testing recommendations as well.
Okay, that's a good clarification to have for sure. And then this is a question coming in again on our website, coming in live. SS asks, do we have any data on how many South Asian kids of Indian origin have been vaccinated yet, and any particular side effects on them, especially myocarditis or I don't know how to say this, or MISC-V, MISC-V?
MISC, so it's multi-system inflammatory syndrome in children.
Okay.
It's a very rare complication of a COVID infection, but can be very, very serious. So we actually have not found any, that any adverse events following immunization have occurred specific to certain geographic locations, for example, across the city. And so that's important to note. They are, again, very rare. And there has not been any notice worldwide that certain ethnicities are experiencing them at a higher rate. And then when it comes to the rare complications, what the US CDC has said is that they have occurred more commonly among racialized groups. They have not named South Asians, though, but that's probably because it's more of the racialized groups that are getting COVID, including the children. And so that's why they are disproportionately getting some of those rare, serious complications from a COVID infection.
Right, okay. Let's move on to some other live questions coming in. One from Andrew on YouTube. I'm assuming this is in children. What percentage of the trials had an adverse reaction?
So the children in the trial, 70% had a sore arm, 40% were tired. That was the next commonest side effect. Only 6% had a fever, for example. And in between 40 and 6% was, muscle aches, chills, headache, for example. So those were the percentages in the trial of the side effects that children experienced.
And anything adverse? Were there any sort of really serious side effects?
So there were no serious side effects that were because of the vaccine. Now, there were serious events. So, for example, they described one child who broke their arm after vaccination in the period that they were being followed, right? It's a serious event, but not caused by the vaccine.
Right, that makes sense. Okay. Let's go to another question from Coral on our website. Do we have to wait for the flu shot after taking the COVID shot for the kids?
Yes, there is a precautionary recommendation from the National Advisory Committee on Immunization. Again, it's a precaution. Like, we want to have the best caution for our children, and that is to wait 2 weeks before a COVID vaccine and 2 weeks after, as much as possible, before you get other vaccines. Now, if it's not possible, if there are different circumstances for which the child needs to be vaccinated either at the same time or in less than 14 days, that would be okay. But as much as possible to try and keep that 2 week window on either side of a COVID vaccine.
Okay, and doctor, why is that? Because I remember we've talked about, as adults, we can take one COVID shot here and one flu shot here at the same time, and it's okay. Why is it different for kids?
It's really just a precaution, and really the real reason is, we're not worried that somehow you won't get a good immune response to the vaccine. It's just if you get side effects after the vaccine, and you had 2 vaccines, it's hard to know which vaccine you got side effects from.
Right.
And we wouldn't want to be in a position where we wouldn't recommend a second dose because you had side effects, and if the side effects were from the other vaccine, for example.
Right. So just to be able to differentiate between which vaccine you're reacting to, if you react to it.
Exactly.
Right. Okay. And then there's a follow-up question from me on YouTube from Andrew. How many 5 to 11-year-old kids have had COVID? And what is the percentage of those children that have had COVID that have ended up in ICU?
Okay, so I had these numbers. I think it's something like 120,000 children in Canada had COVID, and then 300 were hospitalized, 40-something were admitted to ICU, and 2 died.
Okay.
And that's data that was presented by.
Sorry, doctor, we just lost your audio right after you said that data was presented by. We're just reconnecting to audio. There we go. No, we still don't have it. Sorry. Bear with us, technical difficulties. No. Okay, it says connecting to audio. I think we've lost the doctor's audio. We're just going to keep trying for another little bit. Bear with us, please. No, unfortunately not. I wonder. Sometimes the connection just doesn't want to cooperate with us. It's not working. Okay, so unfortunately, I think today we might have to end a little bit early. We've got about 9 minutes left in this Q&A, but I don't think the technology gods are gonna cooperate with us today. Let's see if we can try and get the doctor back. No, it's not working.
Now, can you hear me?
Oh, there we go. Okay.
Oh my goodness. I'm sorry. I don't know what happened there. Wow, that was terrible. I'm just so sorry about that.
No problem. Thank you to everybody for sticking around with us through that. Sometimes these things happen, technology is such, it's not perfect. But thank you for sticking with it, doctor. So you mentioned that the research was presented by, and then we sort of lost it.
Sorry,
we were talking about the number, I think, of
oh yes, the research, those numbers were presented by Dr. Theresa Tam. They're from the Public Health Agency of Canada. Yeah,
right. That's what it was, the number of kids in ICU and things like that. Okay.
Yeah.
All righty. Let's go on to our next question. Where were we? Here we go. Do kids have to show proof of vaccination to enter restaurants now that they are also getting the shot?
So right now it's just 12 plus. The 5 to 11-year-olds have not been added to that program. It will be up to the province to decide if they will add them. So we'll just have to wait and see.
Okay. And then let's go to our next one. Can my child get the vaccine without my consent?
No. So 5 to 11-year-olds will require parental or guardian consent in order to be vaccinated.
Okay. And is that the same for 12 and up as well, or no?
No, so we've talked about before how in Ontario there is no Healthcare Consent Act. So there's no real age for consent. But in order for someone like a child to be able to consent, they have to be what's called capable or have capacity. And often a child who's less than 12 doesn't quite understand the full details for why they're getting vaccinated, what the risks are of being vaccinated and unvaccinated. And it's for those reasons that parental consent is required.
Okay. And then I guess we addressed this, but let's talk about it directly. Are the risks of heart inflammation in young kids the same as for young adults? Because we saw that the myocarditis was affecting younger males.
Yeah, so we know that the baseline risk, meaning, before COVID, we knew that older teenagers and young adults, they got myocarditis, pericarditis. Like that is a heart condition that tends to affect that age group, often because of viral infections, for example. And by comparison, the younger children tend not to get that. So that is what we know from even before COVID was around. Okay. There have not been any reports yet of myocarditis or pericarditis, certainly none in the clinical trials. And then the US has vaccinated over 3 million children, and I have not heard of any reports, but we will certainly pay very close attention because 3 million children is a lot of children. And if there is a rare side effect, we would expect to be able to see it.
For sure. Okay, and let's squeeze in a couple more. Actually, that's for now the end of our, sorry, go ahead, Doctor.
Actually, let me add one more thing on the myocarditis, pericarditis piece for the younger children. They are getting a lower dose. So that also may help to prevent them from getting this if they were to get it. The other point that I think is worth noting is the 8 weeks between the first and the second dose. That also may be really important to prevent this from happening, because we know actually with a longer interval between the first and second dose, you're less likely to get it after the second dose.
Okay, that's a good clarification for sure. So we've come to the end of the submitted questions for kids shots, but we'll still take live ones if you have them coming. So keep them coming. Actually, we have a live question coming in right now. One more from Coral on our website. If my kid is allergic to penicillin, is the vaccine okay to take for them?
Yes, a penicillin allergy is not considered a contraindication to get the vaccine.
Okay, wonderful. So we're going to move on to some non-kid vaccine questions. These are actually booster shot questions that we had from last week's topic. So let's get to a few of those. Sonu asks, I had my first shot, which was Pfizer, and my second shot was Moderna. So what kind of booster shot should I get? What brand?
Yeah, actually, for a booster dose, you can get really any messenger RNA vaccine. So really whatever is available, you can get that. If you had to pick one, you could get the same one that you got for your second dose.
Okay. And then, we have another question from our website coming in live. MC asks, my daughter received the flu vaccine recently. Can she get the COVID vaccine right now, or does she need to wait?
So the precaution is to wait for 14 days. That being said, if it's been a week or 9 days or 11 days, you could still get the vaccine, the COVID vaccine. As much as possible, we're trying to keep that buffer, that 14 days. But if because of logistics or, you couldn't keep it quite at 14 days, that would be fine as well.
Okay. And there's another question live on our website. Now, it's a little preliminary, I think, but let's go with it. Do we have any data on how many 5 to 11-year-olds actually got COVID-19 after they received their first or second dose, like in the trials?
There were, so in the trials after the second dose, I don't believe anyone got COVID. There were a few that got COVID in the vaccinated group. I mean, that's why the vaccine efficacy is not 100%. Now my memory is really troubled here, but I think it was something like 3 in the vaccinated group got COVID and maybe 16 in the unvaccinated got COVID. This was again out of, a few thousand children. Right. So, the vaccine is very, very good, but not 100%, 90% efficacy. I think the other important point to note is in the trials, those children who got COVID, despite being vaccinated, did not get a fever. They had a milder illness.
Okay. And that's the case even with adults, right? The point is that the vaccine, if you do get COVID, it's a milder illness. You won't land up in hospital.
Yeah, that is exactly right. Yeah.
Okay. Some more booster shot questions. PJ asks, I'm 67. I am diabetic and I have high blood pressure. Do I need a booster shot?
So right now, you're not recommended for a booster shot, but there will be more guidance coming. I mean, the province has announced that eventually everyone will be eligible for a booster dose. I think the one thing to kind of give you some comfort is, has it been 6 months since your second dose? And really, unless you're very immunocompromised, people should wait at least 6 months from their second dose before they get a booster dose once they're eligible.
Okay. So this is not a booster question. It's just a question that we get a lot. And I thought it would be good to address it today. This is from our website. Critical Thinker asks, have they isolated the COVID-19 virus yet in order to, get the vaccine and make the vaccine?
So the virus is a SARS-CoV-2. Yes, they have the genetic makeup of this virus. That's actually how they were able to work on a vaccine. Now, the virus itself is not in the vaccine, so you can't get COVID from the vaccine.
Okay. And then, sorry, this is another question, just because I'm guessing people have missed your answer. So let's do it one last time and we'll wrap up. From our website, Brittany asks, is there a time period of when a child gets their flu shot to when they can get the COVID vaccine?
Yeah, so the recommended precautionary time period is 14 days. Right. But again, you don't need to stick to that very firmly. It is a caution. It's really just so that if a child were to have a side effect, have symptoms, that we would know which vaccine were causing that.
Okay. And that brings us to 1 o'clock. Thank you for repeating that answer, Doctor. I feel like that question came up about 3 or 4 times today. Thank you, everybody, for sticking through the technical difficulties. And thank you, Doctor, for your patience with that as well. We will be back next week with another topic. If we didn't get to your questions today, we'll try to get to them next week. So thank you so much, everybody, and see you next week. Thanks, Doctor.
Thanks. Bye-bye.
Bye.